Hi, it's Dr Nicole from Shy Tiger. Let's go through the general anatomy of the dog. For me, it's really important for pet owners to understand the anatomy of the dog because it really helps with communication with your vet, and it also helps you in a first aid situation to understand injuries and what implications they may actually have on your dog. So we've got Nitro here today and he's going to give us a hand. So let's start at the head end. So we've obviously got the beautiful mouth and eyes here. Dogs have much bigger lip folds to us, and their teeth are also quite different. So you can see the main one to notice is that long canine, the fang tooth. And then we'll go up to their nose, beautiful nose, and their eyes, they have an extra eyelid. We can often see that extra eyelid poking out from the inside corner of their eye. So we only have 2 eyelids and they have 3. And then coming up to the ears, the dogs are a bit different to us in that they have a vertical ear canal and then a horizontal one, whereas we only have a horizontal one. So a bit more prone to getting things stuck in their ears and ear infections. Coming down to their neck and down their front leg. So dogs with their shoulder, you'll notice this is their shoulder here and you can feel this bony ridge. Our shoulders have got really good mobility. We can go forwards, backwards, in, out. Dogs is more designed just to go forwards and backwards. So a bit different shoulder mobility. Coming down the front leg, this is their elbow in here, just in that corner there with your beautiful feathers. And down the front, this is their wrist. So also known as a carpus, the wrist is here. Down to their foot, which is the metacarpals on the front feet. They've got 4 main toes. And then most dogs will have this funny little extra toe up higher on the leg called their dew claw. Good job, Nitro. That's for stability during motion and also help with some chewing. Okay, back up the front leg, we've got their back. Obviously the ribs come down here and their abdomen or their bellies here. And then coming to the back end, he's doing well. We've got the hips at the top there. Their pelvis is on a very different angle to us because they're obviously on 4 legs. So we've got the hip up here and we're coming down and this is their knee or their stifle. Lots of pet owners are familiar with that one if they get the knee injuries. You're doing well. Do you want to stand up? And then down the back leg, this is their ankle or their hock, okay? And then down to their back toes, which are called their metatarsals. So front toes metacarpals, back toes metatarsals. Again, they've got the 4 main toes and most dogs won't have a hind dew claw. So back down here, we've got the tail, obviously. Good boy, Nitro. And then if we lift up the tail, just underneath, they've got their anus or their bottom. And then depending on whether you've got a boy or a girl, you've got your vulva in the girls. And in the boys, we've got the prepuce, don't we? Their groin area is just under the belly. If we come under the belly here, and if we run, it's also known as your inguinal area. And then if you run back up the front and the underside, their armpits is called their axilla. So yeah, that's the general anatomy of the dog. I hope that helps everyone.